Prepapillary vascular loops, a new classification. Congenital retinal vascular anomalies include the following: anomalous macular macrovessel, arterial crossings, venous crossings, triple branching, congenital tortuosity, prepapillary vascular loop. Prepapillary vascular loops were described in 1871 by Liebrecht as a congenital vascular anomaly. It originates from central retinal artery on the optic disc. It was initially misdiagnosed as a variant of hyaloid vessels. Recent histopathological and fluorescent angiography studies show and confirm the clinical impression that PVL originates from a branch of either retinal artery or vein ending at the disc. PVL can project some distance into the vitreous. Coming to pathogenesis, retina is supplied by hyaloid artery. At 4th month of gestation, primitive vascular mesenchymal cells near hyaloid artery invade the RNFL, forming retinal arterial system. In rare instances, instead of penetrating RNFL, the vessel grows into the vitreous for few mm into Clockett's canal and then turns back to disc forming PVL. Ansor et al. Analyzed the characteristics of congenital PVL and proposed a new morphologic classification, dividing the loops into 6 types. Their study was a collaborative multi-center retrospective study of 49 PVL cases, which included 61 eyes. These loops were classified based on location, loop elevation, loop shape, loop covering, and vitreoretinal traction. This is the proposed classification by Mansoor et al. In their paper. As we can see, there are 6 types of loops around the peripapillary area. Type 1 peripapillary vascular loop is a flat central single intraretinal loop or twist from the artery or vein without any associated retinal findings. Type 2 is again a flat central intraretinal loop or twist from either artery or vein associated with generalized tortuosity of retinal vasculature. No complications arises from the loop. Type 3 consists of flat radial small loops, either arteriolar or venular origin. They are predominantly seen in Asian population and they resemble clinically that of angioma. Type 4 loop can either resemble a figure of 8 from the artery or vein. Type 5 loop is again a vitreous loop resembling corkscrew shape with fibrotic sheet either around the artery or vein. Type 6 is any loop of artery or venous origin which has vitreopapillary traction that can be demonstrated by the OCT. These are all the 4 tortuosity patterns observed by Mansoor et al. In their paper. We have tortuous, hairpin, loop or spiral. The differential diagnosis for this condition include optociliary collateral veins, retinal arteriovenous anastomosis, cilia-optic vein, acquired loop following central retinal artery occlusion. Coming to the complications, most of these patients are asymptomatic. Spontaneous and recurrent vitreous hemorrhage can occur. Branch retinal artery and vein occlusions can occur rarely. Subretinal hemorrhage and preretinal hemorrhage can occur sometimes, and vitreous traction can be seen in some cases. Points to remember in this condition are: Type 2 may be associated with retinal vascularity syndrome. Type 3 to 6 involve elevated loops into vitreous with some amount of vitreous traction. They may also be associated with vascular torsion and vitreous hemorrhage. Majority are arterial, up to 90%, and up to 20% are bilateral. Asians predominantly have type 3. Coming to clinical examples, this is a fundus photo of a 50-year-old male who came for cataract surgery. We can see prepapillary vascular loop in the superior peripapillary area as delineated by the FFA. The patient had no comorbidities and again FFA showed no leaks. Peripheral examination showed no breaks. The patient underwent cataract surgery and his best corrected visual acuity was 6.6. This is the slit lamp video of the patient's left eye in real time. We can see it is a type 2 loop located superiorly to the disc. This is again a fundus photo of a patient who presented to our OPD with recurrent hemorrhage. The patient is a 20-year-old male with no comorbidities. All systemic workup was normal. FFA done for this 20-year-old male, who is a case of recurrent hemorrhage, shows the type 2 prepapillary loop with retinal vein anomalies. We can see that there are no leaks and there were no breaks in the periphery. The patient was advised strict bed rest and observation. This is a case of type 4 loop seen in a 50-year-old female who underwent panretinal photocoagulation for proliferative diabetic retinopathy. This is the slit lamp video in real time of the same patient showing type 4 loop projecting some distance into the vitreous. We can see some amount of pulsations. Conclude. Prepapillary vascular loop is a vascular anomaly around the optic disc. Origin can be arterial or venous. Clinically, they are often misdiagnosed as neovascularization of the disc. Currently, they are classified into 6 types based on loop tortuosity and patterns. They are mostly asymptomatic and require no intervention. Prepapillary vascular loops can rarely be symptomatic. In such cases, multimodal imaging with fundus photo, fundus fluorescent angiography, OCT and OCTA play a vital role in identifying these conditions and preventing clinical misdiagnosis. Thank you. We have no financial interests.